Hey, everybody. Welcome back to another episode of Interpreting in Healthcare, a podcast brought to you by the National Council on Interpreting in Healthcare and the Standards and Training Committee. This episode, I have to confess, someone that is dear to my heart for many years, but also a very esteemed and respected colleague. Manuel Higginbotham, LBBP, CHI Spanish Certified Interpreter, is a nationally recognized leader in language access. He's more than 27 years of industry experience. He's passionate about improving the lives of limited English proficient individuals by developing creative, full access initiatives in our communities. He has leadership experience in the language service industry, in healthcare and hospitals, and has owned his own language consulting and training company. More than 140 hospitals across the US have relied on his expertise in developing language access plans, training interpreters, and assessing bilingual proficiency. Manuel has led multiple highly qualified interpreter and translator teams at hospitals, including the first ever program to have 100% of its interpreters dually nationally certified. Currently, he oversees the Language Access Services Department for the number one cancer hospital in the world, MD Anderson Cancer Center in Houston. He has delivered training programs of 40 plus hours to more than 4,000 interpreters, including the first known for credit interpreter training program in an accredited school of medicine. Manuel has served on dozens of committees, boards, and initiatives, including the CCHI E2E project and the Interpreting Safe AI Task Force. He previously served 9 years as the president of the Texas Association of Healthcare Interpreters and Translators, fondly known as TAHIT, and his working languages are Spanish, English, and Portuguese. Welcome, seja bem-vindo, bienvenido, Manuel.
Muito obrigado. Thank you so much. It's wonderful to be here chatting with you today.
Yeah, I've really been chasing you for a while, and I'm really, really happy we finally got our schedules to mesh at the same time on the same day. So I can't
I
be more
cleared the entire day
pleased.
for you.
Oh, you're kidding. Too bad we're not in the same geographic location because then we would go out for a nice something afterwards. But
Yes, like it sounds good.
given your resume, it's a long look back to when things really started happening for you in terms of language access, interpreting, and in the world of healthcare. When you look back and see that film reel unspool, what are some of the things that pop out to you as, wow, that was a really pivotal moment and I knew it, or that was a really pivotal moment and I didn't even know it and it propelled me into this direction? What was it that was that lightning bulb or that moment of feeling like, yes, this is what I need to be doing?
Well, I'm getting the feel that the movie is too long. The movie reel is way too long. It should be a shorter movie, but um, I do have one thing that really stands out in my mind, and it was when it's actually what propelled me into the profession. So I was an exchange student in high school. I graduated from high school here in the US and studied an additional year of high school in Venezuela. And when I came back, I was, your typical 19-year-old college student. And this was back when job openings were posted in newspapers. Not sure how much of your audience will know what a newspaper is and where to go to find a job listing. But I saw an ad in the newspaper at the local children's hospital asking for a Spanish English interpreter. I had just returned from a year abroad, and I thought my Spanish was, really good, and I thought that was something that I would enjoy doing, and so I went and I applied for that job. and started off with a language assessment. And I remember very clearly when I came back into the conference room to sit down with the interviewer, she looked at my test results and she looked at me and she looked at my test results and she looked at me with a puzzled look on her face. And she's like, Vaya chico, it was like, I'm very impressed. Your language assessment was really, really good. And so we proceeded with a few questions and, probably 4 or 5 questions. And then she's like, you know what? I want to be very clear and direct here. I don't want to waste your time and I don't want to waste my time, but you blew me out of the water with your test results and you've answered every question that I've asked you exactly as I would hope you would answer them. But um, our patients expect interpreters that look like them, and you don't look like our patients. So we're not going to consider you for this position, but thank you so much for your time. And this was at a moment when I was sure that I was going to, take a pre-law path in my life, but I was still 19 years old. I was very wet behind the ears. I didn't realize that what she had done was illegal. And, I just took it with a grain of salt. But then I left that interview and I was like, how dare she tell me that because of how I look and the color of my skin, that I'm not going to be an effective interpreter? I really think I could do this. And that was step one. That was what kind of lit the fire under me and said, you know what? I'll be damned. I am going to be an interpreter, and I'm going to show you that I'm going to be a darn good one too. And so that was the story that started it all.
That is so interesting because I wonder if the determination would have been the same if she had just said, "You're the top candidate. I'm going to offer you the job right here and now." The fact that she said what she said would have made me kind of go, now I'm really going to go after, get this done, and show you that I can provide good service and the patients will still be reassured, even though our skin tone or width of bridge of nose doesn't match or texture of hair doesn't match. It's all about being seen and being heard, which she did not do for you, which was a wonderful lesson of what not to do to people.
What not to do, or maybe I wasn't good enough, and she was just trying to inspire me. Who knows? But it did come as a backdoor inspiration for me. So
Wow, that is strong. That's a really strong story. I normally don't volunteer too much information because this podcast is my interviewing you. But I have to say, I have a similar story when I was at university and I had some cousins from Brazil come and visit me. I'm the only cousin with who doesn't have brown eyes, and although my skin tans very dark, when I'm not tan, it lightens up considerably more than my cousin's skin. So when they visited me at the dorm, they were stunned that everybody knew I was Brazilian because I had grown up partially in the US as a young child. So my English was never detected as foreign. And both of them separately asked me, "How come you told everybody you're from Brazil? You could pass for white. Why did
wow,
you spoil it?" And I was like, "Well, because that's who I am. What am I gonna do? Hide my parents when they get here or, not tell them the truth about you? You're my first cousin, right?" And but that was how harsh. And it's still very harsh for different categories of people, but at the time, that was how harsh things were, and they were like, "Why are you shooting yourself in the foot?" I was like, "I'm not. It's really nice when you can be yourself and be accepted." So, another facet of the same thing that we still struggle with today. So, when we look
it's so
at
true.
situation today, how have things changed or what stands out to you that is either still the same and needs to be changed, or what are you working on right now that's taking up most of your focus? Could be anything.
Well, interpreting has definitely helped me to see the very best in human beings, but I've also seen the very worst in human beings, and that xenophobia, even sometimes against people who come from an interpreter's same country of origin. And, they may have gotten here a different way with different documents than one of the patients that they're serving. And so you really have to be on top of, those ethical cues and clues that interpreters give you, and if they're going to be a good fit. I can't think of another profession that goes so unobserved and unregulated by a person of authority. I mean, most interpreters, when they're working alone in that room and nobody knows what's going on. They could be interpreting and saying anything, and sometimes they do, but mostly they don't. And just being able to operate on your own and have an interpreter operate on their own and know that they're going to make ethical decisions and that they're going to have the patient's best interest in mind, and they're not going to try to make those decisions for the patient or tell them to stop talking when they go on a rant, because that's not what the doctor asked, and we need to be respectful of the doctor and those sorts of scenarios. So I still see that present, but we work through it, and it becomes a case by case basis. But what's going on right now, it would be impossible not to talk about AI uh, and
Right.
things that are going on in the AI world. And I also see it creating other issues and other problems. And, I'll be very clear, in my lifetime, I don't think that we're going to see AI take over the jobs of human healthcare interpreters. I think the stakes are too high and too important. It may seem like we're on that path right now because it's, de moda. It's what's in, it's what everybody's talking about. It's the new technology. And I don't want to hate on AI. I use AI every single day and I find it extremely valuable. But at the same time, I'm a realist that it is not capable of doing what we as human interpreters do. And so, but even though there are many of us in the industry that know that and we feel that, it's still scaring away the base of new interpreters coming into our profession, and they're scared away because they hear that AI is going to take it over, and they're able to go online and use Google Translate or ask ChatGPT to translate an entire document for them. And so I've seen a fall off. I don't see as many people interested in studying, a 40 or 80-hour program to become an interpreter. I don't see that, that passion as often as I used to see it in the past. And so that has put us in a situation where we're deficient in qualified and certified interpreters at this moment. We don't have enough. There's not enough interpreters to go around. And so that is a catch 22. It's a cyclical effect. It causes us to want to rely on AI more because it's readily available at our fingertips. And then on the other side, we're creating this kind of brain drain in our industry because people are dropping out of the industry because of AI. And so at some point, I think there's going to be a poor outcome for a patient. And I think there's going to be a landmark lawsuit that sues a hospital or tries to sue an AI company or a large language model. And people are going to realize AI can't recognize its own mistakes. AI isn't able to do what humans are able to do. We should be using it as a tool for interpreters, but we shouldn't replace interpreters with it. And so we don't have really any higher education that's teaching AI as a tool for interpreters. And so we're kind of behind the eight ball in that regard. And then we just at some point there are going to be so few interpreters, I feel, unless we make a change quickly, that when AI does come down, when it's realized that it can't replace us, then we're going to be really in the negative when it comes to qualified and trained interpreters to actually do the job. So that's what I see happening in the world right now. That's the hot topic for me.
And I really agree with you that it's counterproductive to either be fearful or hateful towards AI because it's inevitable that it will continue to improve. But what I'm really missing is the opportunity to have that conversation with the people that are developing AI, to have language access people at the table, because there are places right here, right now, that AI would really shine and would take, I don't want to say mundane, but everyday occurrences like wayfinding, description of menu choices or dietary plans or directions to find a clinic or a referral to a specialist or how to get from point A to point B, that AI could be just like they do in the museums in Europe. You pick a language and then
Yes.
it accompanies you and tells you what you're looking at or which way to go or which way to turn or how to fill out a form. There's so much that it could assist with, and that would free the human interpreter to be present for that nuanced conversation that I'm sure takes place at almost every encounter in a hospital like MD Anderson, specialized for cancer, but any children's hospital or any inpatient situation that not yet ready for. Like, let us help you make it better is
Yes.
what I believe Safe AI Task Force is trying to do. And I was happy to see that you're part of the admin subset, and we'll see where we can go. There's the glimmerings of legislation to
Yes.
control how AI is implemented starting to come out in the US. The EU is way ahead of us in terms of not authorizing, people's images to be used without their consent or manipulation by AI, that there has to be a hard opt-out option available for people when AI technology is being used to assist
Yes.
any process. I'd like to see that kind of stuff take place here, but we need to start sort of rattling the cages or shaking the trees, whatever the idiom is, to make those ripples spread a little bit farther. So anyone listening to the podcast, if you have a family member that works in IT or writing code or in AI, like, please encourage them to take a peek at organizations like TAHIT or NCIHC and join up. We need to make alliances. We need to befriend each other rather than have some silly waste of time standoff. We could help each other's industry improve, I think, but that's
I
looking
could not
towards the
agree more.
future. So as you look towards the future, and we've got the short term, every day we wake up to some crazy news headline, and then we have the longer term, 5 to 10 years down the road. You mentioned you were worried about the fact that there is even a smaller pool of candidates being attracted to interpreting as a profession. What else is concerning you as you cast your eyes ahead to the next year, the next 3 to 5 years?
Skipping the next 3 to 5 years, that would be great. Let's just get to 2028. That would be the goal, right? But we have to face it. We have to run the gauntlet. We have to go through the process and can't cheat time. But um, I think the human element and the empathy element are something that we could all go back to relearning for ourselves, especially in healthcare. When you're sick and you need the services of an interpreter, you're experiencing a bad time in your life, most likely, or perhaps one of the most joyful times in your life. There was finally a cure for the chronic disease that I've had my entire life, or I've just given birth to twins, or those very, very bad moments in a person's life with a diagnosis or learning about a loved one's diagnosis. And just reintroduce the human element and the empathy that I think is lacking in our country, perhaps in our world today, um, it's that basic human condition and the emotions that we have and empathize with. And so I tie that into what I'm working toward in the goals. And, during the COVID-19 pandemic, we became reliant on distant and remote interpreting. And providers and hospital workers across the country found out that it's a very convenient thing to provide a service on demand at the touch of a button. But I think, and I hope most people would agree with me, and I don't want to knock on OPI or VRI. We need all modalities of interpretation. We absolutely need all modalities, but I would really love to see hospitals, especially those patient experience departments, truly look at the experience that a patient has when they have an in-person human interpreter standing beside them, and the relief that comes, and the relief that you can see on their face, and the clutching of your hand as you stand next to them and begin to speak to them in a language that they understand. And so moving away from that convenience and that service model that we saw happen during the pandemic out of necessity, and then we've just retained it. Medical services have gone back in person. We're relying, what I find is, less on telemedicine than we did during the pandemic. Let's do the same for healthcare interpreting. Let's bring our interpreters back on site where most of them want to be in the first place. And we know that it's better for our industry. Certainly interpreters working on site and as staff for a hospital are making more money than their OPI and VRI counterparts. And you see what's happening. You're aware of the entire situation. So that's what we're working on at MD Anderson, is making that justification, and it's showing the value and that return on investment with having on-site in-person interpreters.
That's a really good point, tying the telehealth visit numbers to in-person interpreting availability or usage. Um, and they should be tracking, you would hope, similarly rather than having a disparity. I mean, the good thing about the pandemic, if there was any good thing, was that those that had resisted using technology to make language access possible got sort of thrown into the deep end of the pool and had to
Yes.
learn very quickly how to do this. But now they learned, and so it's an additional tool. It shouldn't be the only tool.
And not a replacement.
Yep,
Absolutely. I couldn't agree more.
So wrapping it up all up in a bow at the end here, we both do what we love. Are you still having the opportunity to create training and content for your staff interpreters, or does your facility help facilitate their attendance at conferences or membership in professional organizations so that they have access to continuing education?
Well, I am so incredibly lucky, and I recognize the luck and the privilege that I have to live where I live and work where I work and be surrounded by the team that I'm surrounded with. Things are really good in my professional life and here at MD Anderson. But we live on the Gulf Coast, and so weather events are an ever occurring reality for us. And in our last fiscal year, we had some difficulty around those weather events. We had a winter storm, which our area of the country was not prepared for, and we also had a hurricane in the same year. And so that caused some issues with being able to provide opportunities, but certainly the idea is there that we ask for and request those resources to make continuing education available. This particular past fiscal year, that wasn't possible. We couldn't send our team, not a single person, to a conference. but we got creative and we thought outside of the box. So we decided to host the conference at our hospital so that we could provide opportunities for those. And so we were very fortunate to be able to welcome, and we're so glad that TAHIT agreed, but the Texas Association of Healthcare Interpreters and Translators agreed to host their event on site in our conference center within the hospital. And so that was a phenomenal success that just happened this past September 12th.
I'm so glad you shared that idea because for folks listening, bring this idea back to your language service, interpreter services departments at your medical center, at your teaching hospital, because it is a genius out of the box idea. Everybody is trying to do more with less, and there's so much talent, as one of my teachers in high school used to say, diamonds in your own backyard. There is so much talent if you just look for it and are open to recognizing it. And that's what I think professional organization membership helps people do. You get to connect with other people that do what you do, interpreters with interpreters, translators with translators, supervisors and managers with other admin folk, purchasers get to talk with other people. Ooh, have you heard about this service? How do you do this? Or how do you handle that? Schedulers.
But as you were saying, I could not again agree with you more. Maybe that's why we're such good friends. We agree on so many things, right? But I completely agree about that opportunity and thinking outside of the box. And for those who are in language access leadership within healthcare institutions, let me talk about my team and how they came out of their shells, and how I saw them shine when they were playing host to the event, and all of the tremendously hard work that they did leading up to the event. No worries at all. And I'll kind of just finish. I did see that you dropped off, but I was agreeing with exactly what you were saying, what I last heard from you about those opportunities to share and network and bring people in that might not normally attend a conference for language access services. And you're so right. We absolutely saw that happen inside of our walls. And I was just, I continued talking even though you weren't here. I thought I would fill the dead silence in the space. So never give an interpreter a microphone, right? And so, but I was just talking about
It's never a problem.
never a problem. But what I was able to see with our team internally, they really took to heart the challenge of playing host to the interpreting services world for a weekend, and I saw them shine in so many ways. And they volunteered and they put in literally hundreds of hours of work in preparing. And so, if you're looking for a team building event or opportunity for your language access team, hosting a conference from an organization, or creating your own, just I saw the team shine in a way that I had never seen up until that point, and it was a phenomenal experience.
Oh, that's a great insight as well. Who knew a team building exercise is also a
Right.
profession building exercise?
Absolutely.
Well, it's been great, and I appreciate your flexibility and your ability to pivot on the signal loss, and always your willingness to collaborate with NCIHC and with improving the profession and language access for all of those who need it. Thank you so much, Manuel, for joining us today on today's podcast. And folks, stay tuned because we're recording some more and they'll be issued soon on our website and posted on YouTube. Thanks so much, everyone.
Thank you. Bye bye.